My name is Shaeba Rizvi, and I have been involved in healthcare since 1992 in terms of education. So one of the questions is, can we do it and what do we need? What you need is just to be able to read and write, and we need a high school diploma, and that's how we enter into the program. Yes, many people enter into the program who are coming from clinical backgrounds, medical backgrounds, healthcare related fields, because the program also allows you a wonderful avenue to, maybe for someone who's been treating patients in their native country, now they've immigrated to Canada and they want to get back into the feeling that you get when you treat patients. The clinical environment is very different, and people who are used to that, it's hard for them to do other things. So to be able to interact with a patient, treat a patient, contact them, because even physical contact with a patient requires licensing and diplomas. Not everybody can do that. So to know that in 18 months you would be in a clinic treating patients, that's a big deal. It is the health field, it is biology, it is pathology and treatment, so there's a lot of information we have to process in this field, which is why some people tend to shy away from it. But my passion is in showing students that you don't have to be scared of big textbooks or big words or big vocabulary. It's all very easy when you have the right approach. So since 2006, whatever I've been doing, that's been my passion. That's why I've never left private college and the industry and the environment. I love it. I love that there's so many different people from so many different countries and so many different ages and so many different backgrounds and careers, and you're putting them all onto the same platform to understand how actin and myosin protein interact with each other to cause muscle contraction, and how ATP is used and how enzymes are used. So when everybody starts to click and understand, and many of them coming from backgrounds where this stuff was difficult for them, but they realize, hey, this is quite doable, this is easy. That's what I enjoy the most. And that's where you change a mind forever. So you cure a patient, you heal a patient, but they get sick again. But when you change a mind forever, who was it, Mark Twain? Who said that? I don't know, you always see it on a poster in colleges, right? Where it says on the wall that once a mind is expanded by knowledge, it never returns to its original dimensions, right? And that's why after getting into this field of feeding knowledge to people, I haven't wanted to do anything else. Not to say that clinical practice is not a wonderful endeavor. You make people's lives better, and they respect you for it, they admire you for it, and they love you for it. And if you can get people moving again, because that's what we do, that's what physiotherapy and occupational therapy is, get people moving. And why is it so important nowadays? Why? Because if you look at healthcare and you look at how we have improved, I think we've improved a lot in terms of this part of our body, where we now know how to keep the brain working, the heart working, the lungs and liver and kidneys and intestines, and these systems working. But where we have failed is the arms and legs. The arms and legs might not seem too important, but the arms and legs are what give your life quality. So if these organs are working, that's great. You can do that in a hospital. Your doctors, physicians, surgeons will do that for you. And you'll live till 90 or 100, and our lifespan is increasing. But after 70, 80, if we can't use our arms and legs, or after an accident or a disease, if we can't use arms and legs, then we lose quality of life. So physiotherapy and occupational therapy keeps you moving, and that allows good quality of life. Medicine is up here now with these organs, the arms and legs. We need to catch up so that people who are 90 are still fully independent and functional, less drain on our economy, less drain on, all the PSWs have to work so hard in all the nursing homes. But if these people were independent, then their lives would be better, and the society would be better. The industry is booming, it is still expanding. Anybody who lives anywhere in Ontario is going to tell you that, look, there's a physiotherapy clinic opening up there. There's a physio clinic opening up there. The reason is physiotherapy and occupational therapy are babies. They're still growing. That means medicine is over 1,000 years old. Physiotherapy and occupational therapy in their full professional form are about 100 years old. That's a big difference. That's a baby. So a baby is something that's still growing. The use and the application of these two fields is going to continue to expand. So you're entering into a growing job market. I would like to say to all future students who are interested in this program to realize that you're entering into a field where it is not just a job, but it becomes your existence. You're 24 hours. When you're in healthcare, you're not in healthcare from 9 to 5, 24 hours. You have expectations. Society expects things from you. They expect you to behave in a certain way. So you have to become a role model. So not only are you entering into healthcare to find a secure economical situation, you are now a role model for society. Your truth, your honesty, your veracity, your sense of justice, it needs to be strong within you. And that's one of our main focuses. I like the PTA-OTA program because I don't teach one subject. I train the student entirely, which includes not only theoretical knowledge and clinical training, but a strong sense of ethical standing. Who am I and what is my role in society? So I tell them to come in with that passion, to know that you're going to make a difference and change people's lives, and you're going to make them better.